Hello, Mamava family. I am Nikki Kent, and we are so excited to be here today to talk all about sex and love for our Valentine's Day special with Dr. Anya Koutras.
Oh, thank you.
Thank you for being here.
Thanks for inviting me.
We're so happy you're here. Can you tell us a little bit more about you and as a what we're calling an expert in maternal health and wellness?
That is very kind and generous. I'm a family doctor, and I've been practicing for 25 years, and I deliver babies. So
Yay.
I take care of lots of moms, babies, partners, families, and it's every year I keep saying, well, we'll see how it goes, getting up in the middle of the night and delivering babies, and it keeps going because I love it. And I have two daughters. They're 16 and 19.
Awesome. So thank you for being here with us. And we're excited today, friends, for you to comment and interact with us. We've got a cute little Mom of a Onesie that we're giving away. And so we're really happy to hear from you about all of your questions and comments that you might have on sex and love while you're breastfeeding and postpartum. And so that's what we're going to focus on a little bit today. And we did this amazing survey where we reached out to our community to understand what they wanted to learn about sex and love. And we got some amazing responses and feedback. I mean, it's just like we are really proud of this community that wants support. And we're happy to provide some experts to help them. So I've got some great questions that came out of it. Shoot away. Just to give you a little bit of context, about half of our respondents are currently having sex. But of that, 25% are saying it's not so hot right now. And that is probably natural after baby. I mean, I've had two, just to give you context. I would love, they have lots of questions about libido and feeling touched out. I think they really want to know, what's normal after having a baby. So I'd love to share your experience and what you recommend to moms.
Well, I love this topic because a lot of times it does come up on visits with moms and with babies, and being their family doc, I have lots of opportunity to talk about sex. I will say, I had one question about the survey was, how they define sex. Is it just intercourse? Are they having, sex can be defined, there's so much to experience sexually with yourself or mutual masturbation or oral sex, and I think sometimes people think, oh, am I having penetrative sex, and is, defining it that way.
And it's that black and white. That is a really good point, Mom. So if you're thinking about it, give yourself a little credit if it's beyond just traditional sex. And then
there's no prescription or expectation, just like how you parent and how you recover. I mean, you've been through a lot. You and your partner have just gotten through birth. And you will look at each other, I think, with admiration. So there's that. And I think there's no expectation when you're going to feel sexually connected to yourself, which has to happen first, and with your partner. But the key is communication. I feel tired, or I feel sore, or I'm insecure, or I feel overwhelmed, I'm stressed. I mean, you've just brought another little being into the world, so you and your partner have a lot more to be stressed about, to be tired. So start there. If you're talking, then you're halfway to having sex.
That is a really good recommendation. And I think, when would you recommend traditionally that those conversation gates are opened? And obviously it's a question of who initiates those conversations, but the mom who's just gone through all of these changes with her body and the hormones, and maybe her libido has changed postpartum. Really kind of timing wise, when do you really recommend that a woman would introduce it? Or
I think couples are great if they start talking about it before baby comes, because already during pregnancy that your body's been changing. It's so obvious, and sex may have already changed during pregnancy. So it's a great time to be talking about it with your partner. And then with breastfeeding especially, you're in a low estrogen state, so things are drier in the vagina area, but they may not be less sexual or less sensation, and so people have to just really be in touch with what feels good, and when they want to do that. You know, I think here I tell couples when they're getting ready for childbirth, you know, 3 things if you're at a loss of words to the partner to say, just say, you can do this, you're beautiful, and I love you. You know, like when they're about to push, whatever.
So good.
And then I tell them, look, and you can use that afterwards too.
Yeah.
You can do this.
It doesn't
I
just
love
apply
you,
during
and
birth.
you're beautiful. Exactly.
That's so good.
And you know, foreplay starts with like, what are you doing to help your partner to show appreciation, to help them feel less stressed, to feel less tired. You know, partners will often say, you know, when I take out the garbage or I do housework or I make a meal, suddenly, you know, there's more interest in being intimate. And I've been there. I mean, right? I mean, you know, when you know that your partner's going to pick up the child, right?
Yeah.
And you can go get a massage. You can have time with your
Totally.
friends. Because, you know, sex isn't just about you and your partner and defining it to the relationship and your relationship as a parent. It's who you are.
Yeah.
It starts with your relationship with
Absolutely.
yourself. So making sure you have that intact.
I love that. So, fans, if you're just tuning in, I'm Nikki from Mamava, and I'm here with our expert in all things sex and love, Dr. Anya Koutras. And she just made a wonderful point. Talk about sex before you even have the baby, while you're pregnant. I have a really funny memory. We were filming this Pumpcast while I was pregnant with my second baby, and the question came up, what do you miss the most about like not being pregnant? And I blurted out sex because I felt like, and I'm like, I'm not saying I'm not having it, it's just not as comfortable, and it changes, your body changes.
Yeah.
So that's really great. So that actually transitions nicely into our first question about changes to your body after birth. So we've got some questions around, you know, when can you typically conceive? And are those hormones there? You know, the traditional myth around you can't get pregnant while you're breastfeeding.
Yeah. Well, so there's when can you conceive and when do you want to conceive too. So, but back
Good
to
question.
lactational amenorrhea method, which I think you're referring to.
Yeah.
If you're exclusively breastfeeding, your baby's under 6 months, and they're not getting anything else but your breast milk, and you have not resumed your periods, that's called LAM, or lactational amenorrhea method, and it's like 99% birth control. But I always say lamb becomes lame if any of those 3 criteria are not met. So
98% is probably the key too.
And for some people that are worried about that 2%, like that's going to get in the way of their connection and wanting to have sex, then use birth control.
Right. It's as simple as that.
Yeah.
Some moms are asking like some questions about after birth. This is I'm kind of chuckling a little bit because I'm visually thinking of this. Has my G-spot moved? Or has it been covered by a layer of scar tissue? Like it's in there, but like how do I get to it? How does my partner get to it? Like that was a frequent question we saw.
Well, it's so funny. I love that question because I have often said to parents, you know, and I say to both of them, that after you have a baby, it's like someone went in there and moved furniture around. So just know that, you know, there's not been a growing baby without furniture being moved.
That's a good point.
And so it takes a while for it to shuffle back.
Yeah.
And so lots of love and caress and connection is really important before there's even penetration. So I would say, you know, if a woman is kind of resistant or anticipating it's going to be painful, there's not going to be an inclination to want to have sex.
That's right.
So, you know, getting involved with everything else that feels good before penetration is key. A sense of humor, time. You know, people are tired in the evenings, so waiting to have an evening date often doesn't work for partners.
But mornings can be so hard. Like I think I would say my number one thing I miss post having kids is morning sex. It's like that doesn't exist anymore.
Yeah, right.
Which is like makes me like it's just, unless we get up at 4 a.m, which is like not.
Or you start thinking outside of the bedroom, right?
Well,
and especially if your child has
happen.
somehow found their way into your bed. So just create, you know, little rendezvous in the rest of the house or the apartment or wherever it is. And maybe set your alarm and meet your partner at 3 a.m.
Yeah.
But you don't have to. There's no expectation that this is what you should be doing. And a lot of studies show that partners also go through sort of a nesting phase after baby comes on board. And so parents may both be blissful and happy and not having sex and enjoying that first few, you know, weeks and months of having a child, and that's fine. The key is that they're communicating now.
Yeah, that's great. I feel like something that's been really important is that communication with your partner is key. It's going to enhance your sex life to where you want it to be. Okay, so that is super helpful. Questions about postpartum libido. You had mentioned, you know, it's funny, I'm going to tell a personal experience of, you know, I have felt that it's changed from child to child.
Yes.
And, you know, like no changes in libido at all. First child, second child comes. Just minor tweaks and changes, to your point, like rearranging the furniture.
Right.
So what can moms expect?
Again, communication and also talking to yourself. And there's a lot of things that go into how you feel about yourself and your own libido. There's a lot of, you know, factors like being tired, maybe being depressed. You know, we don't have time maybe to talk about postpartum depression, but it's real and it can happen for all partners actually.
Great point.
So just make sure that you're thinking about how you're feeling with yourself.
Yes.
And then just connection, you know, when you have fallen, maybe there's been a dry spell. You know, couples go through dry spells, like towards the end of pregnancy, maybe everyone felt uncomfortable, and then there's another dry spell right after baby's born, and so you're sort of like, you've forgotten how you liked it.
Yeah.
And so sometimes just going to therapy, sometimes maybe just spending time during the day. You're so tired in the evening, maybe both take a personal day and spend time during the day and go for a hike. Do the things that are fun, that connect you to that partner. Why did you fall in love with them in the first place? And that's what gets you sort of interested.
Those are great answers, because a lot of moms are asking us, when will I have my sex drive back? Like, when will it come back? And I think it's important to be a little bit introspective and say, first I need to make sure that I'm connected to myself, and then what are the connection points with my partner, and that can help drive towards a better sex drive.
And you mentioned the G-spot. I want to go back to that because, you know, I get a lot of questions about that even by people who aren't having children. And, you know, the G-spot's sort of like the Bahama Triangle, you know, or is it the Bermuda Triangle? Sorry. But, you know, it's like kind of like this description of what is that. And I think it's really just referring to the tissue that's around the clitoris. And a lot of times penetration is not what hits the clitoris. Sometimes it does, depending on position. But a lot of times manual and oral stimulation of the clitoris is what gets a woman to have an orgasm. So talking to her partner about that and having an orgasm is a great way to de-stress. But it may not involve penetration. That might be one of the last ways to have, you know, sex with your partner. So I think if partners can be on board with that and have an open communication, maybe some mutual masturbation, some mutual oral sex, everyone's feeling better, then they're more inclined to go back to, you know, the saddle, so to speak.
Right, and it creates less stress because you release those hormones.
Right.
That's very smart. A quick question that I had about rearranging the furniture and your pelvic floor. So again, personal experience, way different pelvic floor experience post first baby than post second baby. And you know, do you recommend pelvic floor exercises and you know, potentially therapy?
So this is where the pelvic floor physical therapists come in, you know, are tremendously talented at what they do. And I've sent a lot of people there. And it may be for dyspareunia, pain with sex. It might be with incontinence. It might be pelvic floor pain when they sit, all the above. They had a traumatic birth. And with time and patience, that gradually almost always improves with that type of physical therapy. And I've had men that have had, whether it's been abdominal surgery or weight loss or weight gain, also report symptoms, you know, of incontinence or not pleasure, and I've referred them, and men also benefit from Kegels.
So good to know. Hey ladies, it's not only you. You can tell your husbands or partners to practice Kegels as well. It's not always up to us, which is nice.
And some people want to know what a Kegel is. So I have, you know, a lot of people after birth want to know what a Kegel is, and I tell them to picture you're sitting on the floor naked, and you have some marbles, and picture you trying to pick up a marble with your vagina or with your yoni.
Love it.
Yeah, and then they understand that's where the Kegel is. Sometimes during an exam, I may also, you know, have them show me how they're doing their Kegels, you know, if they're doing their pap smear or pelvic or whatever.
Awesome. Those are great recommendations. I guess the last question that we would have and that I think our community is looking for is, you know, how do you talk about your breasts and how do you feel comfortable with something that's milk producing and those being a part of the bedroom? And how have you talked with patients about that?
Yeah, well, you know, just like the rest of your body, a lot has changed, and when you're breastfeeding, it's an obvious change.
Yeah.
So some women actually don't like the sensation sexually of their breast being touched, and so they can be waist down girls. You know, that for that time period, that's what works. It's not their whole body.
Right.
But again, communication is really key. Some people note that they have an increased sensation that they actually enjoy, and they wonder, is that okay? Does it make me a bad mom? No, nothing makes you a bad mom.
Right.
And so they may find a heightened sensation before they pump or breastfeed, and so they want to have sex then, or maybe they feel better when their breasts are empty, so they want to pump or feed their child and then have sex. So again, listening to their body and knowing what feels right for them.
Perfect. Those are great suggestions. Okay, so I think that's all that we have for today. Unless you have any last minute suggestions, do we have a onesie giveaway to do? We do. Okay, perfect. So Angelica Busato Smith, DM us for your information. You get the mom of a onesie. Thanks to all for joining for today. Happy Valentine's Day.
Happy Valentine's Day.
Coming to you from Mama Va. Thanks for being here, Dr. Anya.
Thank you so much, Nikki.